today obviously we are talking about disability and older people. So what is disability? Disability is actually an umbrella term which usually covers impairments. So impairments means a lot of things in your body which could be impaired, and it causes activity limitations. So it basically causes limitations in you to do things, and ultimately leads to restrictions in participating in things which you would actually want to sort of do. So an impairment, of course, can be basically for your body part or function structure. So as I have said earlier, activities of daily living is usually your personal care activities like eating, bathing, dressing, using the toilet. And instrumental activities is like shopping, managing medication and all. So disability usually can be because of chronic illnesses, which includes one is foot problems, then is arthritis, then cognitive impairment, that is memory impairment, heart problems, to a great extent vision. And other common problems that can cause disability include, of course, hearing impairment, because hearing and vision are very important. Then chronic diseases of the chest, which include, along with heart failure, then heart disease, then also even stroke. Then falls and, of course, hip fracture as well. So once you fall, then of course you have a limitation, and then once the limitation sets in, you are obviously disabled. So till you obviously improve. Now, what are the risk factors? Now, frailty is something which is supposed to be a risk factor. Other risk factors include, for example, arthritis, diabetes, then visual impairment, obesity, then memory impairment, presence of depression, then walking difficulties, slow gait, and sometimes even having very bad social relations, and of course sedentary lifestyle. I mean, being sedentary can be a big risk factor. Now, before we go into the disability part, the normal aging process, you have to understand that there will be a changes in your body composition like muscle bulk, then in your ventilatory capacity, that is breathing capacity, then restrictions in your kidney function, also restrictions for your vitamin, uh, even your sensitivity to vitamin D. Then elasticity of the eyes goes to an extent, the hearing impairment also happens. Now, comorbidities that contribute to disability include, one is stroke. As you know, stroke can lead to weakness, difficulty in walking, problems of communicating. Then heart disease, especially if I've had a heart attack. Alzheimer's, which is one of the most common causes of neurodegenerative disease or memory impairment. Then urinary problems like urinary incontinence. Then depression can play obviously a very important role and can cause the disability to get even worse. Visual loss, hearing loss. Visual and hearing, if it is there together, that can lead to real severe depression as well. Visual loss can cause the risk of falling. And falls, of course, a fear of fall can, if it causes injury, it causes pain, it causes loss of function, and that can lead to obviously more problems. And if there is osteoporosis, that is of course weakness of the bones per se, especially your bone matrix, vitamin D deficiency as well, then that can cause more risk of falls. Now, how do we assess for disability? Of course, we have to see the damage system, which will be very clear. Then communication, what is your mood, other body systems, then how active you are. As I said, activities of daily living, instrumental activities of daily living. Then your supports, both formal, informal supports, and your environment, immediate environment, which will be clothes, housing, then your locality, what are your social activities. Then how do we manage? Now, manage was the most important is we have to treat the unstable medical conditions and review your drugs. I mean, drugs can cause a lot of disability, especially through the side effects if you are on too many drugs, multiple drugs. Then we try to obviously do early mobilization. By early mobilization, I mean try to make you walk much earlier. Nutritional support is important, and rehabilitation, which will be done with or without, of course, the physiotherapist helping us. Now, usually in management, it will be a multidisciplinary approach. So a geriatrician along with a physiotherapist, a dietitian have to actually sort of take care of it. Now, aspects of management include contributing causes. We have to, for example, if you have a heart disease, if you have a respiratory disease, if you have a neurological disease, you have. Very common things like reversible causes of hearing loss. Sometimes just wax. So wax, you're not able to, if there's a ear wax, you just remove the ear wax, hearing impairment goes, and then your disability reduces. Then neurological conditions like if you have any tumors, they can be removed. Drug treatment, of course, might contribute to disability also. So we have to be very careful. Polypharmacies, that multiple drugs we have to reduce. The lesser the number of drugs, the better. Then also vitamin D. Vitamin D deficiency should be recognized and also treated at the earliest as far as in the elderly is concerned. As far as surgery is concerned, of course, age alone is not a contraindication for surgery. So if your multimorbidity is not there and your illnesses are fine, then you should go for joint replacement, cataract surgery, surgery for prostate, because all these things can cause more of disability if you don't do it. Then, as I've always said, aids and appliances always help. Occupational therapy, things like grip rails, stair lifts, removal of dangers, loose carpets in your house, which can actually cause falls. Aids which help you, visual aid, hearing aid, glasses. Then magnifying glasses can be used, large print materials, talking clocks, watches can be used, telephones with large numbers, audio books, and safety measures so that you are able to sort of, for example, if the kitchen equipment is there, it should be in raised areas and not very high, very low, so that it is ideal at an ideal height so that you can reach it. Hearing aids can help in improving the quality of life. Sometimes a lot of people have an issue with the hearing aid, but then that is something you have to sort of channelize with the audiologist, and please try to use it. Don't try to not use it. Then pain management, I think, is another thing which is very important. The earlier we address pain management, the better it becomes. Then social and environmental modifications or interventions, financial support, of course, if you need it, then it has to be provided. Social support, especially having a strong social connections with people, then friends, then social activities are very important. And housing support, for example, if you're on the ground, if you're on the first floor with no lift, then how can we be helping you to make sure that you're actually independent? Now, disability to an extent can also be prevented. It can be done by, of course, exercise. Now, exercise has a very important role. It depends on at least around 30 minutes of moderate intensity physical activity should be done 5 times a week. So around 150 minutes you can do in a week. Again, always warm up. Do not start to be too active, and it's not too late to start exercise. So there is no age. So don't think if I have not done it, it's too late to start. The earlier you start, the better it is. Then nutrition is again very important. Avoiding obesity is very important. Have your dietary fiber, address your constipation. If you have risks like diabetes, hypertension, then cardiac disease, then alter your diet accordingly. And of course, supplementations when and where needed are very important. Now, another thing which is very important is how do we detect disability? I think health checks are important. Annual health checkups can help. Then if you screening programs, especially for vision, hearing, dental problems. A thorough assessment of an older person for disability is always needed, even if the older person thinks he or she is normal, because when we do this comprehensive assessment, then only we are able to know. So specific interventions which include is of course your annual vaccination, which can be of influenza, and of course 5 years vaccination for pneumococcal. Then regular eye checkups are important. Then hearing test is important. Disease screening, especially for cancers like for breast cancer, for cervical cancer for females, then for prostate cancer and bowel cancer for both. Then healthy diet and lifestyle is always contributory. Then again, always another important intervention is to prevent falls and osteoporosis. So you have to take your vitamin D supplementation, and you also have to get your vitamin D levels done maybe once in an annual health checkup. And basically also make sure that whatever appliances that you are adding to, for example, your aids are there, they're actually helping to improve your life and not to make you more dependent. So that is something you have to have in your mind. Never think that no, you're actually getting dependent on them. It is an extension of your body. It helps in making you more independent. So that is something you should take into mind. So that was just in short just to tell you about disability and older adults and how what conditions can cause that disability and how are certain ways you can obviously try to overcome that particular type of disability.
Can I ask something? Carol,
Yeah, sure.
can I ask if we have any marks or any warts on the face, we should take note of it, right?
Yeah, you should take note of it. Of course, for how long are they been there? Is the growth sudden? Is it slowly growing, or is it been there for years together? If it has been there for years together, then suddenly nothing will happen. But of course, there's a sudden change in the size, length, discoloration. Then of course you need to take note, and maybe if you need, then you
Yeah.
sort of consult. As far as removal is concerned, it is purely cosmetic. I don't think you always need to remove it. If you feel so, you should. If you don't, you shouldn't.
Yeah. I was not asking in reference to myself. I
Okay.
have noticed you have two little warts on your forehead,
No, this is
which was not there before.
yeah, yeah.
You are young, you are hardworking. Take care of yourself. We need more people like you.
Okay, thank you. Thanks for those wishes.
Yes.
Thank you.
Please look after yourself.
Yeah, sure.
Yeah. Okay.
Doctor, it's nice to see you slightly embarrassed.
No, not really.
Any other questions for the doctor?
Good afternoon.
Yes, Angela.
Good morning, doc. Is
Yeah.
the calcium tablet, the shell cal tablet, is the same as the vitamin D tablet, or should
No,
I
no,
take
no. No, usually calcium tablets are completely different. And vitamin D, of course, will come in separate, that is in the way of a sachet or in the way of a capsule or a tablet. So calcium can be usually taken daily, whereas vitamin D usually is taken once weekly, maybe for 6 weeks if you're taking in a sachet type, and then or the tablet type, and then you can continue it monthly. So usually that's how you usually take vitamin D. So they are both separately.
But for vitamin D, should I undergo a test or something?
Yeah, usually we don't always undergo a vitamin D test. We tend to obviously see sometimes even X-rays indicate to us know that the bones might not have that strength, or after a certain age, if there are risk factors already, then we usually try to supplement it. If a baseline health checkup is done and a vitamin D is seen, it's fine. If it's not, then we usually supplement. Our only thing of doing vitamin D is we do not want to overcorrect also, because ultimately what happens is if overcorrection of vitamin D happens, then the bones become more brittle. So it says no, you shouldn't go over as well. It has to be in the normals, because a lot of older people, what has happened is they have taken injections, and then we have realized that it's become so high that we'll have to actually stop and then make sure that that excess vitamin D goes up. So that's why we tell them to be careful.
What's the difference between a shell cal M mineral one and a normal shell cal?
Not much of a difference. It's just the salts which are different.
Okay.
And certain people can actually, there are also combinations of vitamin D and calcium as well in the tablets also, but the amount of vitamin D is not that much in that.
Could you name some, please?
Yeah, actually Shellcal is Gemcal D is there, Shellcal D is there, some are there. So basically I would say that you should always look at the content, and then only sort of I mean, when your doctor prescribes, of course these are not over the counter. You should never take any medicine over the counter, even if it's calcium, even if it's available, you shouldn't.
Oh, okay. Thank you very much.
Doctor, a question on what you had discussed is something which is there any resources in India where you can actually go and find what are the different aids available for, let's say, hearing or eyesight, or let's say for walking or for supporting your back? Is there any place where somebody can go and see, oh, this is available in India? Can I have a look at it? I think a lot of people know that.
Yeah, there is a startup, of course, known as Seniority. So Seniority is a startup, so it has got a website. It has links in which where you can actually look at companies of hearing aids, companies of even what you call physiotherapy. I mean, if you need any walkers or if you need any sticks, so it is there. But I would always say try to search for it only after you have a prescription, not to look at what is available and then you sort of decide for yourself, because it's like every shoe doesn't a single size doesn't fit all. So you need to get assessed, you need to know what you're hearing this is. Then once you've been prescribed, of course, then you can look at your options and then try to buy them. So never go on. For example, a lot of older adults are like, my friend uses this stick, so I bought it. So that doesn't work that way, because even the stick, the height is important, where you're holding, whether it's actually causing it will cause an increased risk of fall if you use the wrong one, because it will not support you properly. So those are things which are very, very important.
Thank you, doctor. Any other questions?
Yes, I have a question. Doctor, you spoke about calcium. So there is calcium, zinc, calcium, magnesium, sulfate. So is it okay to buy a variety of these calcium tablets and take them over the counter?
I would say they are available over the counter and they are not really unsafe in any way. But it's always best that you have prescriptions for any tablet. Purely because even calcium, for example, we need to make sure that what salt you're taking. For example, there is also something known as hypercalcemia. So you don't, if you correct yourself over that, your calcium becomes more than normal. That is also not good. So we need to maintain it. Usually the dose that we prescribe around once daily, 500 milligram, doesn't really increase your calcium to a great extent. And you need to keep drinking adequate amount of water. So I would say calcium, always any medicine in general, better to take with prescription. Unfortunately, in India, most of the medications, a lot of them, in fact, are available over the counter. Even
Yes.
so that is something you should restrain yourself with, especially calcium, vitamin D, and painkillers. I would say painkillers the more so, because painkillers are just too freely available. So that is something you need to show restraint while buying.
Okay. So you would advise not to buy it over the counter?
Yeah, I would advise you not to buy over the counter and look at what molecule you have been prescribed by the doctor, because ultimately there is no real reason for you to keep changing the calcium. I mean, if you're taking a fixed type of calcium and it is working for you, then you should continue to take that, because it will come in different. For example, calcium can come with other vitamins also. Calcium can come plain calcium also. Calcium can come with a combination of vitamin D also. But always I would say ultimately, if you are taking a drug, you should know the content yourself. Even if the drug is being removed and given by someone else, please have a look at the content, because it's very important that you know. Ultimately, it's a drug. It's a chemical which is going in your body, so you should know what the content is.
Doctor,
Okay.
can I ask you something? Can I ask
Yeah.
you something?
Yeah, ma'am, sure.
Hello. Can you hear me?
Yeah, I can.
Okay. You know what? I have been taking Calcimax for a very long time. And it has been okay with me. I mean, I have no problems or anything. So can I continue, or have I to take a break or ask the doctor or something like that, or just continue?
No, usually calcium can be continued. It doesn't
Okay.
really cause you a lot of
Okay.
side effects. The
Yeah.
amount of calcium is not much.
Okay.
It only keeps it at a normal level.
And I take
Calcium,
and I
think
take
calcium.
Beckersules also.
Yeah, that's also okay. I mean,
Yeah, okay.
I would prefer you to take more vitamins through fruits and vegetables. But yeah,
Okay. Yeah,
certain
but then this I've been taking for years and I'm okay with it. So I just continue.
so you can continue. It's not a
Thank you.
I think we shall now hold back any questions on calcium. But are there any other questions regarding disabilities? Any kind of ways in which you can slowly overcome these things? Any questions on that? Doctor, let me ask the last question if there's no other question. For people who have visual disabilities due to aging, where they can't see as well due to deterioration of your sight, are there any good aids besides a magnifying glass that can help people?
Yeah, I would say magnifying glass is one. Then, of course, try to modify it. For example, try to have things with bigger font. You try to adjust, bigger clocks. These are things you need to do. So it's like if you are not always able to modify what is there in your body, then you need to modify things around you so that you are able to sort of get better visual aids, especially like large print materials. Then talking clocks. I mean, for example, if you're not able to say, then the time will be set. Then if you, I mean, everybody loves reading books, but now there are audio books as well. So these are the things I would say the best way to sort of know your vision is actually to check it. At least an yearly check should be there. There is a great tendency for us to be like, nahi, abhi thoda sa dikh raha hai, so it's okay. We'll just see. Chashma ka shayad number बढ़ गया होगा. I mean, we'll see, and then we'll see becomes an year, and then from that number it becomes huge. Then things like cataract and all are very much treatable. So those are things which should never be delayed till your vision is really started to sort of get affected. And it's a very standard surgery. So these are the things which should never be avoided. Then of course there are things like glaucoma which can be more severe. So of course they are also sort of treatable. But I would say once that disability to an extent starts to set in as far as impairment is concerned, please don't push yourself till you reach a level of tolerance where things are very bad. Try to show it. Ultimately, it's always prevention is better than cure in medicine. That is the rule always. Cure part always comes when things cannot be handled by prevention. So try to make sure that your quality, because remember the quality of life will be affected. And yeah, that answers your question. In general, I would just want to say disabilities sometimes can be permanent and can be sort of temporary. So when the temporary state of disability is there, it's always something which you can come out of. Now, sometimes permanent, for example, if you say that you had an accident and then some part of your arm or whatever, or you had permanent vision impairment in one eye. So that also can happen in certain cases. But again, that's the beauty of it. Ultimately, people do adapt to that also. So I would say never lose hope in any kind of disability. There are correctables and there are non-correctables, but always try to focus on what you can correct, and always try to make sure that you're trying to prevent the disability, because disability can cause a lot of other issues, especially mental issues. We are trying to focus on what things, risk factors can prevent disability. So that is, I think, more important. So more physically, mentally of it, and more social interaction you have, the amount of disability that you have might be comparatively lesser. Apart from that, yes, we have an aging body. We need to know your body and try to keep doing those checkups so that we actually can correct whatever we can.
Thank you very much, Doctor. I think we'll end the session today. We're run out of time. This has been really helpful. Two things again. In case anybody would like to talk to Dr. Prem, write to us on Tare Social and we'll send you his number. The second thing is this talk, as well as all of other Dr. Prem's talk on Tare Social, have been uploaded on our website. Please go and look at the website. You can listen to any of his earlier talks also. It's a very good revision. I know a lot of people are already doing it, but I'm just reminding all of you guys. So without further delay, thank you very much, Doctor. And guys, everybody, have a great weekend. And we'll see you back on Monday. Thank you.
Thank you.
Thank you. Thank you, Prem.
Thank you.
Prem.